In today's video, I want to talk about adhesive capsulitis, otherwise known as frozen shoulder, and what exercises tend to work best, what program tends to work best for people in the later stages of this condition, the so-called frozen and thawing stages of frozen shoulder. Hi, Dr. Brian McGee, physical therapist with Rexercise. So adhesive capsulitis, otherwise known as frozen shoulder, is a condition where the connective tissue deep within the shoulder becomes inflamed, it stiffens, and scars. Now, this can be caused by injury. It sometimes happens after surgery, but most of the time it's idiopathic. It just comes out of no place. Now, it seems to be that folks with diabetes and folks with thyroid problems are at higher risk, but those relationships haven't totally been teased out. Now, this condition generally progresses pretty consistently through 3 stages: freezing, frozen, thawing. Now, why is that important? Because it seems that the best therapy treatment is matched to the stage of the condition. So those in the freezing stage are generally in a lot of pain, their range of motion is going down, and our reflex is to stretch them aggressively because we want their range of motion to improve. The problem is that aggressive stretching seems to simply irritate the shoulder more, prolonging the condition. So those in that freezing stage, often it's best to treat them kind of gently. And as they progress into the frozen and thawing stages, pain is going down, they can tolerate a little more stretching, a little more aggressive stretching, and they can make a lot more progress. So this video is about how to progress in those later stages. Our first stretch we simply call a prayer stretch or child's pose. I like to use the stability ball. You don't have to. If you don't have a stability ball, you can just have your hands on the floor. I think the stability ball makes things quite a bit easier. So anyway, kneeling, hands on the ball, simply roll the ball forward until you feel some pull in that hurt side shoulder. Hold for about 10 to 20 seconds. Again, if we're in that frozen or thawing stage, we're trying to increase our hold time a little bit, increase our intensity to match the irritability of the shoulder, so only stretching up to pain, not really beyond. So I get to 10 to 20 seconds, I take a little break, a few second break, go right back to it, 10 to 20 seconds. Now, as you progress through these stages, you get into that thawing stage, you can stretch a little harder, increase your hold time to about 30 seconds, and progressing further still, simply reach the ball a little bit further forward and then try to lift the hurt side arm. Hold for just a few seconds. So this would be something done really in the latest stages of the condition. Your range of motion's almost back, but you still have some lingering stiffness. You can try this one. Lift up, hold for a few seconds, come on down. 10 repetitions. This next stretch works on external rotation of the shoulder. And arguably, this hits the part of the shoulder, this stretches the part that is most affected with adhesive capsulitis, the stiffest, most painful part. So be a little cautious with this stretch, a little conservative. So keeping the elbow into the ribs, hand against the door frame, and you're simply going to turn away from the hand until you feel pulled. A little pain is okay, but again, we're not stretching beyond pain. Again, hold this for about 10 to 20 seconds and then relax for just a few seconds. Repeat the stretch. And again, as with the other stretches, we'll do 5 repetitions. Be careful to keep the elbow into the ribs, right? We're not reaching out this way. Elbow stays into the ribs. Turn away from the hand until you feel some pull. The progression of this stretch, and we're stretching now at a little bit different part of the shoulder, bring the elbow, forearm, and hand against the door frame and perform the same movement. Simply turn away from the arm. Stretch should be felt in the shoulder. Again, a little pain is okay. Hold for the 10 to 20 seconds. This next stretch works on internal rotation of the shoulder. Arguably, this is probably the toughest stretch of the bunch for those with frozen shoulder, but I would argue probably the most useful. So take a twisted up towel, twist it up the long way, put it behind the back. So in this example, my right side is the hurt side. I'm simply going to reach behind myself, grab the towel, and use my other hand to pull the hurt side hand up the back until I feel a stretch, some pull, a little pain's okay. Again, at first, we'll go about a 10 to 20 second hold, and as symptoms subside, try to crank the arm up a little further, again, only to the point of pain, not much beyond that, but increase the hold time to up to 30 seconds. And as you can see here, as I can reach up my back, I can do things like loop a belt, tuck in a shirt, all of which are super difficult for folks with adhesive capsulitis. This next stretch is more advanced. It's definitely for those in that thawing stage of the condition. For those with some lingering shoulder stiffness, this works really well. So you're going to need one of these foam rollers, and you're simply going to lay down. It's a little awkward at first. It takes a little bit of practice, but no big deal. And I call this the roller angel. So you're going to move your arms like you're trying to make a snow angel. Okay, so you're trying to keep the backs of your hands on the floor for the entire arc of movement. Now, with frozen shoulder, you probably won't be able to quite do that. The arm will be kind of up here somewhere. That wouldn't be weird, but do your best to keep the hands as close to the floor as possible through the entire arc of movement. Do about 10 repetitions. Those are the home exercises that I most often give to my patients in the frozen and thawing stages of adhesive capsulitis. Again, we're trying to match the intensity of our program to the irritability of the shoulder, to the pain. We're only stretching up to the point of pain, not very much beyond that. And that seems to really be the sweet spot in intensity to really get the best result. So I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, leave a comment. I'd like to know how you're doing with your adhesive capsulitis recovery, and we'll see you in the next video.